So this is the LifePak 12 that you'll be using here at Cypress Point, and it is used for basic monitoring, as well as it has AED capabilities, defibrillation, cardioversion, and pacer capabilities. So we'll go over just the basic front of the monitor so you can see, obviously on and off button. Okay, and it'll show your rhythm across here, and we have a normal sinus rhythm. Here is your lead size, or which lead you want, either paddles, which I don't want. We want lead 2. This is your selector button, so you can select which lead you want from right here. We want lead 2. Press that in, and that'll give us lead 2. Here we have size, and we can change the size of our rhythm there, our visual there. With the selector, again, go up and down to where you want it. Press it, and you'll have the size. And you can print your EKG. Here is your print button. Just a simple strip of your EKG, initial rhythm. Press it to start and press it to stop. Okay, and then this blue here with the arrow is your AED options for your monitor. You may not be using this in a hospital setting, but it is here for BLS if it is needed. So you have to use hands-free pads for AED. You would put these on your patient, front and back, or sternum and apex. Connect your cable and connect to your cable here, and then you will have your lead. Press lead, put it on paddles. It will have your paddles, and that'll be your lead for your paddles. Then you turn your AED on to analyze.
Analyzing now. Stand clear.
The AED will do everything else for you. You
No
just
shock
follow instructions. So it tells you no
Check for
stop.
pulse.
Okay, so then you would just say, if you wanted it to,
If no pulse, start CPR.
it goes through the whole thing, the whole BLS for you. And if a shock were advised, you would, it points to the arrow points to what you would do. You would, the energy select should already be there at 200, and you would charge the button, charge it up, and then shock. Just like, and it tells you every step of the way. So we'll turn that off.
Analyzing now. Stand clear. No shock advised.
Okay. So then we'll go through the defibrillator section of the monitor, and that's over here in the gray. Obviously, energy selection. This is a biphasic monitor. Typically starts at 200. That just means you don't usually need as many joules as a monophasic. So you start at 200, but if you wanted to increase your joules, you just go, up, and it shows you where you want. Okay. And then you press charge. Allow it to get a complete charge. And it tells you to push the shock button. If you decide you don't want to shock the patient, you can release that charge just by pressing the selector button here. And that will release the charge, the energy. When you are using the defibrillator, you have an option to use the paddles here. You would have your leads on, your 3 leads on. You'd use your paddles. Apex and sternum, you have to have defibrillator pads on the patient before you would put these pads on. And you can charge from here. And you press both red buttons at the same time as they're firmly placed on the patient, and that will release your charge. And you can increase your energy here So it could be a one-person defibrillator unit here, which is these hands. Your other option for defibrillation here is the hands-free paddles, which is the most commonly used in hospital setting. And these are the same pads that you would use for your AED. So you would place them on, placement can be front and back, or sternum and apex. Either or works just fine. So in the same sense, hands-free, then you would come here. Adjust your energy select to where your doctor wants it. Charge and shock. And then if you're needing to cardiovert the patient, this is your synchronize button. You press sync before you press charge because you want the monitor to find where you want to shock the patient on the appropriate way, in the appropriate waveform. So you'll see these little triangles come across on every QRS. You know that you're in sync. It's blinking. You can press charge again. And then you would shock. When you do press shock on a synchronized cardioversion, you may have to hold the shock button down because it's not an immediate shock. The monitor has to find the right place to place that shock. So you have to hold the shock button down until you do have it. It may be a delay there. So just be aware of that. So we'll turn that off. The other thing you can, this monitor has is code summary and events. And if you are in a code situation, at the end of the code, you can press this code button, code summary, and it will give you the strips throughout the code, just a quick summary, an overview of your code. On events, if you do have enough personnel present, you can come in here. If you've given, atropine, IV, you come in here and you can press it, and it will mark that strip at that time. So it kind of shows the medicines that you've given at that time. Of course, you have to have plenty help, somebody here at the monitor at all times to be able to do that. So that may not always be feasible. The other section of this monitor here is for pacing. And again, you have to use your hands-free pads for pacing. And in a pacer setting, you have to have the electrodes on, the 3 leads on the patient, as well as the hands-free pads. The pacer cannot check the rhythm and pace without both of those on. So they do have to both be on, be aware of that. And then you just turn the pacer on, and your doctor will give you your rate and your current. Rate's usually 60 to 70, depending on what you're doing. In a cath lab setting, they may even just go down to 40 or 50, just enough to, in case the patient breathes down real slow. Your current, and you can again use your selector button to go up by 5 increments, or you can just go up with your arrows by 10. Press your selector. So you would be pacing your patient. And then if you're pacing your patient, and the doctor asks you what is your patient's intrinsic rate, you can press pause, and it will give you the patient's intrinsic rate and let up, and you get your. I'm not seeing my pacer spikes. Did I not have my rate up? Oh, because I didn't have my rate up. Okay. So we had our rate set at 50, and that's why we didn't have any pacer spikes. That's a good lesson there. So we'll increase our rate to 70. Where was our MA? We don't have any MA. So we have an MA of 10, a rate of 70, and now we see our pacer spikes before every QRS complex. So let's try that again. We want to see the intrinsic rhythm. We can just press pause, hold pause down, and you'll see the spikes, the pacer spikes do disappear, so you can see what the patient's doing intrinsically. Let it up, and your pacer spikes will return. Or you can just turn the pacer off. It's pretty quick and pretty easy. The other, this button over here, transmit, is if you were going to transmit that data to fax or phone. There is capabilities on these monitors to do that, although we don't really use that. Acadian Ambulance uses that sometimes when they're transmitting the data in. And home screen brings you back from wherever you are to the home screen. Options here, you have alarms. You can set all your alarm limits, whether you want it to alarm if the patient goes into VTAC, VFib, on, off. Options, this is where you would do a user test, which should be done once a day on every unit. So you would go under options, scroll down to user tests, press select button, and it'll do its own testing. And then when it's finished, it'll print out a strip that it did pass the user test. And that's usually what you document on a daily basis, that they have been checked. User test passed. And this strip says so. And again, your events button is where you would press for, CPR was started, and that would come up on your strips as you press your code summary.